How much does fracture surgery and rehab cost? Imagine breaking a bone and wondering what it will take to get back on your feet. The cost of fixing a fracture can vary a lot, depending on many factors. When you have a fracture, an orthopedic surgeon is usually the specialist who treats it. They decide whether surgery is needed and what kind. The type of fracture matters a lot. A simple broken finger might cost less to fix than a complex broken leg or a compound fracture where the bone pierces the skin. Surgery costs without insurance can range from around $16,000 to over $40,000. For example, fixing a broken leg often costs between $17,000 and $35,000. Fixing a broken arm usually starts around $16,000. More complicated fractures tend to be more expensive because they requiring more time and special techniques. Additional costs include anesthesia, which can be up to $2,500, emergency room fees that can be between $1,000 and $2,000, and hospital stays that cost about $2,800 per night. If you need an ambulance to get to the hospital, that can add $500 to $1,200. After surgery, rehabilitation is a big part of recovery. Physical therapy sessions usually cost between $150 and $500 each. The total number of therapy visits depends on how severe the fracture is and how fast you recover. Insurance can help reduce out-of-pocket costs, but you might still pay co-payments, co-insurance, or deductibles that can add up to thousands of dollars. For example, if you have a high deductible insurance plan, you might pay most of the costs until your deductible is met. The location of the treatment also affects the price. Surgeries done in outpatient surgery centers tend to be less expensive than those in hospitals. If a highly trained orthopedic surgeon works in a specialized center, the costs might be lower because they can do the procedure more efficiently. Overall, fracture surgery and rehab costs are influenced by the type of fracture, how complex the surgery is, where you get treated, and your insurance. Without insurance, the total can easily reach tens of thousands of dollars. Planning ahead and talking with your doctor and insurance provider can help you understand what to expect and find the best options for your recovery.